WellSpan Health is an integrated health system serving more than 650,000 people in South Central Pennsylvania and Northern Maryland. WellSpan includes 3 respective hospitals. York Hospital, a 572-bed community teaching hospital and level 1 trauma center with 6 residency programs. Gettysburg Hospital, a 76-bed community hospital, and WellSpan Surgical and Rehabilitation Hospital, a 73-bed facility that provides a specialized treatment environment for patients in need of orthopedic, spine, and rehabilitative care.
Additionally, the WellSpan Medical Group includes more than 500 highly respected primary care physicians, specialists, and advanced practice clinicians in some 52 locations across the region. Specialty areas include cancer care, cardiovascular care, neurosciences, orthopedics, women's health, behavioral health, and more.
More than 8,400 physician, employee, volunteers, and board members are committed to providing patients with the very best in health and wellness care.
As a nonprofit community resource, WellSpan provides more than $18 million each year in uncompensated medical and outreach services, supplies, and physician care.
Tower 3 is an orthopedic, neuroscience, and trauma unit in York Hospital. We have 3 Joint Commission disease-specific certifications: total hip replacement, total knee replacement, and stroke care.
Our vision. Tower 3 is a safe and trusting environment where patients, families, and members of the healthcare team work in partnership to achieve patient-centered goals through the education, teamwork, and compassionate care.
Hi, I'm Astrid Davis, and I'm the Chief Nursing Officer here at York Hospital for WellSpan Health. And I think we had a wonderful opportunity to participate in the TCAB project when we did. It really allowed our staff to develop some ground-level ideas to work on improvements that would be effective at the unit level. TCAB really allows you to learn in various ways, and always both through successes and failures. Failures are just as important, and oftentimes you really learn more from those, which you then can share with others. The whole process has on many levels energized the staff, and they have certainly experienced increased vitality and teamwork, which was very evident through this whole process. The team also had an opportunity to present to our hospital board, and I believe the energy from the project was really felt there by the board members. It really gave them a very different perspective about nurses' work at the unit level, so that was pretty exciting to see. The staff, they didn't only participate in their own improvement, but they shared some of their learnings with other units who have now adopted some of the TCAB methodologies for improvement projects that they're working on. So overall, I can say this has been a really very positive experience for all of us here.
What are you doing sitting down? I have been so busy today with my 4 patients. It's been crazy. Like, I haven't had a chance to sit, chart, go to the bathroom, or even go to lunch. What is going on?
I don't know, because my 4 patients are easy. As you can see, I'm just sitting around not doing much.
Well, that doesn't seem fair at all.
Are you having a better day today, Becky?
I'm having such a better day today. Thanks to this acuity tool. I have 3 patients, but my acuity is 13.
Oh, yeah, I have 5 patients, but my acuity is still only 13. So that seems pretty fair.
I think so.
Hi, my name is Valerie Hardy-Sprinkle, and I had the privilege of being the Vice President of Patient Care Services and Chief Nursing Officer at York Hospital, part of WellSpan Health, back in November 2009 when we were selected to be a member of the TCAB Cohort 2. I know that we did that with our sister hospital, Gettysburg Hospital, and together the 2 hospitals from WellSpan went on the TCAB journey. I was able to attend all but one of the TCAB conferences and workshops that were done over that 2.5 year period of time, and was very impressed with the depth and the breadth of the conferences, as well as the tools and the techniques and the learnings that our team was given to be able to come back and look at how do we transform care at the bedside. Most specifically, one of the improvement strategies was the rapid cycle of change. And we thought we had been doing the rapid cycle of change, the PDSA cycle, here at York Hospital, but it was through the TCAB education and through the TCAB journey that we realized we were doing a very slow and not in any way rapid cycle of change. And so we used the TCAB techniques to really make some very quick, several-day, week-long small tests of change, which have proven to be very successful. One that I would highlight would be the Patient STARS program that was developed on Tower 3, the ortho-neuro unit, which was then picked up by many of the other hospitals in our particular cohort. We found that the concept of snorkeling was very successful, and we had many folks, not just on the unit, but also physicians and other disciplines involved in the snorkeling process, and that altogether this has been an extremely effective and successful initiative for us to be part of.
Sometimes in healthcare, it seems like we make changes just for the sake of making changes. With TCAB, I feel like the changes made are the result of staff input in order to improve the processes. And the changes work because their ideas and suggestions come from us, the staff nurses.
Hi, I'm Judy Gunther, Nurse Manager of Tower 3, and I'll just tell you a little bit about us. We are a 55-bed unit. We have neuro patients, ortho patients, and trauma patients. We have 112 staff, 2 assistant clinical nurse manager, a clinical nurse specialist, and a part-time educator. So you can just imagine how hard it is to make any change here. You tell one person about the change until it gets to the 112th person, it sounds like something different. So I am really thankful for the opportunity to be educated in TCAB. It has changed the way we do business on Tower 3, and it will be the way we continue to make changes here on Tower 3. And we do have the opportunity to spread that change to other units in the hospital, and we are so happy that we can do that. Thank you.
Good. Go.
Hi, Caitlin. How are you doing? Good. Now that you're back from surgery, you got you all nice and comfortable, right?
Yeah.
Okay, well, here's your call bell. This red button will get a nurse if you need anything at all. Especially if you have to get up to go to the bathroom, we want to make sure you call us. You're connected to these little orange things that help your legs and your IV pole, so you might trip over some things if you try to get up by yourself. Okay? So do you know what button to push if you need to get a nurse? Alrighty. Well, I'll see you in a little bit, okay?
Man, I have to pee. Oh, she told me to call, but I can do it myself. Whoa, whoa, whoa! What are you trying to do? I have to pee. Well, that's why I told you to call me.
Patient falls have been at the forefront of our focus on our safety-based trials and using the TCAB methodology. Falls are a serious problem in every organization, and we take them very seriously. We implemented several measures to try and improve falls on our unit. One being a sit tight, use your light signage program, another being the over 65 and anesthetized program to prevent falls by using personal and bed alarms. Additional methods are highlighted on our storyboard.
Welcome back from surgery. How are you feeling?
Sleepy.
Sleeping? Well, since you're so sleepy and you might get a little bit out of it, we're going to put on this personal alarm, okay?
What do I need that for? I'm
Well,
25.
I know. Well, what it is that if you forget to call us and you sits up, it makes a beep, just to remind you to then use your call bell. If you also forget, there's a lovely sign that tells you to keep tight and use your light for your safety, okay?
Right.
And this little table tent here kind of explains why we need to put a personal alarm on everybody that had surgery. Okay, do you have any questions?
No.
If you need anything at all, you need to hit this red button to get a nurse, okay? So you want to give me a call if you have to get up.
Alright.
Can you tell me what button you have to push?
I don't understand. I can do this myself, but
Alright, well make sure you call us, okay?
gotta pee. Oh, crap. I guess I should call her.
Oh, Caitlin, did you need something?
Yeah, I forgot. But thankfully that thing went off or I wouldn't have remembered to call you.
That's why we put it on, for your safety.
And I saw the sign.
I'm going to talk a little bit about how we've spread some of our TCAB methodology here at York Hospital. We've really been fortunate to learn from Tower 3 and are starting to spread what we've learned from TCAB just beyond Tower 3's walls. Those of us here at York Hospital nursing leadership have been very interested in understanding what's pulling our nurses away from the patient's bedside, and we want to increase the amount of time that they're spending with their patients. We've adopted some of those TCAB methods to look at performance improvement and process improvement and understand how our nurses are spending their time and identified some areas where we can increase the amount of time they are spending with their patients. What we've done is incorporate 2 other units into this process. They're utilizing TCAB principles and looking at that, and we really hope to, at the end of this month, do some data collection to show that we've improve the amount of time that our nurses are spending at the bedside by implementing a couple of small changes on these 2 units. So it's really been a great process for us, and we're grateful for what TCAB has taught us.
I don't know anything about that patient.
Our patient stars are one of the first trials that we had achieved great success with. They are near and dear to our hearts. We found them to be a great tool in involving all care team members and employees in keeping our patients safe by being able to answer their light sooner. The stars signify patients' mobility and ability to get out of bed and their assistance level. This is one of our most successful innovations that we have spread furthest throughout the hospital.
I have to go to the bathroom.
You have to go to the bathroom?
I do, and I'm very, very thirsty.
Okay, well, I know this, according to the star, I can take you there by myself, and you're thirsty. Well, according to this whiteboard, you're your NPO, so I have to check with your nurse first.
TCAB has given us the tools to continue on our journey to provide patient-centered, quality care, continually striving to improve outcomes, to deliver more efficiently, and to continue to provide the vast amount of services to the most people for the greatest benefit.